Is my screen visible to all? Ritika? Is it visible?
Yes.
I think I can see some thumbs up. Yeah. All right. So today's session, as I said, is about skincare in different age groups. And I would encourage you to stay back till the end, because in the end, I'm going to take a free 5 minutes personal consultation about skin. Whoever wants to ask me any questions regarding your skin can ask me. So I would really highly encourage you to stay back till the end of the webinar. So let's begin. Okay. So as I mentioned, my name is Dr. Ankita and I'm the founder of Ankita Skincare Essentials. Today, I'm talking to you not only as a doctor, but also as a patient, because for years, I have been, battling with super sensitive skin and acne. And it took me years to understand my skin and what really worked for it. So basically, through my own personal struggle, this brand was, came into picture, that is Ankia. So all of those things which I'm going to talk about today in today's webinar is not only medically, but also as a natural based or what you can do at home. I'll be talking about that as well. So without further ado, I think we should start with our webinar. All right. So what are we going to cover today in this webinar is, first, we will understand different types of skin. I will be taking a small quiz just to help you understand what your skin type is. Then we will go through skincare through different ages. See, every age group has their own skin issues and concerns due to change in hormones and their physical activity and environmental changes. So we will be specifically talking about that age group and what all issues they have and how we can overcome that. I have kept men's skincare separately because, again, their skin is slightly different from ours due to hormones and other reasons. So we will be discussing that as well. Then we'll be bursting some myths, some common myths about skincare that we have. We'll be bursting that, and I'll be telling you certain facts also about it. In the end, we will discuss about common skincare problems like acne, hyperpigmentation, wrinkles, dry patches, etc. And as I said earlier, in the end, I'm going to take a free consultation. Whoever wants to ask me any question, please feel free to ask me. You can even write the questions on the chat box or the Q&A. And in the end, we will be answering all of that. Okay, so let's begin. Okay, let's start with the quiz. Don't worry about this quiz. You don't have to give me the right answer. There is no right or wrong answer. All you have to do is that you have to see which option is closest to your skin concern or your skin type. And we can, understand what skin type you have. It is just for your understanding. There is no right or wrong question. You can even choose more than one option if you feel that your skin characteristics are quite similar to what is written here. Let's start with our first question. Okay. My skin feels tight and dry after a face wash. So whenever you wash your face, after the face wash, what does it feel? It feels very dry. So the option A is yes, I need to moisturize immediately after the face wash. Option B is no, it feels much better. There is no shiny skin, there is no stickiness. Option C is I don't feel anything. My skin before the face wash and after the face wash was just the same. There is no change in that. Option D, I don't wash my face as it irritates me. I'll give you a few seconds to answer the question, whichever option you think is closer to your skin type. Okay. Moving on, I'll go to the next question. I hope you've answered it. Okay, next one. What is your daily routine for your face? A, applying moisturizer every couple of hours. You need to, put a layer of moisturizer in a couple of hours. Option B is dabbing your face with a blotting paper or a tissue paper. After every few hours, you feel like, patting your face with some tissue. That is, if it's closer to your skin type, you can choose that. Option C is sometimes I need to moisturize and sometimes dabbing. That depends upon the time of the day or, the environment you are in. Option D is I leave it alone. Anything that I apply on my face irritates my face, be it lotion, cleanser, even water. So you don't do anything for your face. Which one do you think is closer to your skin? You can write the option there. Okay, moving on to next one. I think few people have already written the answer. Okay, question 3. What do you see in the mirror? You see a dry, dull, flaky face. You see a shiny face. Or your face couldn't be better. I think you feel fabulous about your face, how it looks right now. Option D is red, uneven, and pimple-filled face. What do you see in the mirror when you see yourself? B and C. Question 3, option is A. All right, good. Okay, moving on to the next question. When you touch your face, how does it feel? Do you feel rough and tight? There is stickiness. It depends on the face, which area of the face you are, touching. So it could be either sticky or it's tight. And option D is I don't touch my face. Anything, if I touch it burns or it hurts. Which one do you think is your skin closer to? C. Sanvi has also written C. Sneha, C. All right. Okay. So people who have opted for option A in most of the questions, their skin is closer to dry skin type because there is tightness. You need to apply moisturizer very frequently. So whoever has opted for option A, their skin is closer to dry skin type. People who have opted for option B, that is sticky or it's shiny, their skin type is closer to oily. So they might have an oily skin type. Option C, people who have opted for option C, either it is a combination skin or it could be a normal skin type, wherein you don't really have to, go through a lot of problems. Option D is, I don't touch my face because it hurts. Those people who have opted for option D in most of the questions, they might have sensitive skin because anything that you apply irritates your skin and there is inflammation, acne issues. So it's closer to the sensitive skin type. So I hope you got a rough idea about your skin, but we'll be discussing about it further. So let's start with understanding different skin types. So there are several criteria that can be used to identify and differentiate different skin types. However, today we are only going to talk about it from cosmetic point of view. So from cosmetic point of view, skin is classified according to the several factors related to its balance of these 3 things which I've written: sebaceous secretion, hydration, sensitivity level. Now, what is sebaceous secretion? There is a gland called sebaceous gland, which is present on your skin closer to the hair follicle. Now, what this gland does is it secretes sebum. And sebum consists of cholesterol, it consists of, wax and oils, and it basically consists of many more things which protects the skin. It makes a barrier on your skin. And this helps in lubrication. It helps in preventing, infection of bacteria and fungi and other things. So basically, sebum is very important as a skin barrier. But excessive sebum causes oiliness of the skin, and less of sebum causes dryness. So that's why a balance of sebaceous secretion is important. Second is hydration. How well your skin maintains hydration or maintains moisture. That also defines different skin types. And sensitivity level. That is, when you apply any new product or any any item that is put on your face, does it irritate your skin? Does it create any inflammations? All of those come under sensitivity level. So let's start with our first skin type, that is normal skin type. So if you have normal skin type, then let me tell you, you are blessed because there is minimum acne issues, there is minimum imperfection, there is the pores are hardly visible. It's there, but it's very, it's not clearly visible. It's very small. And normal skin type will have not too dry, not too oily skin. And there'll be not much of sensitivity. So you can try different products on your face. It won't really react that frequently. But if you are blessed with normal skin, I would suggest not to, take it for granted. So these are the things which you should be avoiding. you should avoid leaving makeup overnight. So if you've applied makeup, so make sure you wash it off before going to sleep. What it does otherwise is it clogs the pore. And after clogging the pores, inflammation and chances of acne increases. So you should always make sure that you wash your face before going to the bed. And you should avoid smoking and alcohol because it lowers the collagen level, which further increases the chances of aging faster. So moving on to the next skin type, that is oily skin type. Okay, so if you can see the picture here, I'm sorry, it's not very clear, but if you can see the nose and a bit of cheeks area, it's very shiny. So that is the first characteristic of an oily face, that it is visibly shiny. And if you notice the nose area, if you can see my arrow mark, you can see enlarged visible pores. So the pores are enlarged in oily skin. There is clogging of the pores as well. There is extra oil, excessive sebum secretion happens, due to which the dead skins and the, the germs and bacteria and dirt can get clogged on the pores of your skin, which leads to blackheads and acne, which is what is the main characteristics of the oily skin. Now, what an oily skin type person should avoid is over scrubbing of the face. Scrubbing once a week is fine because it helps in exfoliation of the dead skin. However, if you over scrub your skin, what happens is your skin becomes irritated. And then the chances of sebum secretions becomes more because it wants to create a barrier. It wants to bring the oil back, the natural oils back. So your face starts looking more oily and the problem increases rather than decreasing. You should be avoiding sweaty undergarments because, again, of the clogging of the pores. And try wearing cotton, airy clothes, avoid sun, avoid any synthetic clothes. Third is popping and squeezing pimples. What happens if you pop or squeeze a pimple is, when you're squeezing it, chances of bacteria or any infection going deeper into skin becomes higher, which leads to, infection spreading out to the rest of the area. Also, acne scars can become prominent and becomes difficult to get rid of. So always avoid popping or squeezing of the pimples. Now let's go on to the next slide. That is a combination skin type. Okay, so if you can see the picture, the forehead, the nose, and the chin area is mostly oily in combination skin type, and the cheeks area, that is this part, are drier. So this is called a T-zone. The forehead, nose, and the chin makes a T-zone. So some area of this skin type is dry and some area is oily. The T-zone is mostly oily. Blackheads are mostly found on the nose because of the oiliness and the clogging of the pores. Sebaceous glands and sweat glands are not homogeneous. That means they are not. They do not secrete the sebum in a uniform manner. Some places the secretion is higher, some places is lower. Certain parts of the face are shiny. Okay, and what should a combination skin type should avoid is cosmetics that contains alcohol, because it irritates your skin further and causes dryness. General treatment for the entire face should be avoided for a common reason, obviously, because certain parts is oily and certain part is dry. So what is advisable is use spot treatment. So if you have like blackheads, to use salicylic acids or treating acne treatment medications on that part of the skin, not on the entire face. Okay, moving on to dry skin type. If you can see, the picture is quite evident. Dry skin type would have flaky skin. There'll be fine lines, tightness, sensitivity, and visible fine lines. And certain parts would maybe red and can be itchy. What a dry skin type should be avoiding is multiple showers a day, because that strips away the natural oil that your skin produces. Harsh soap should be avoided. Prefer soaps which are closer to your skin pH level, or a glycerin soap because it will attract moisture and keep it hydrated. And harsh cold weathers and dry weathers should be avoided as it further increases the dryness of your skin. Moving on to the next skin type, that is acne-prone skin type. We have separately kept acne-prone, sensitive skin types, and mature skin separately because the characteristics of these skin types is different and the treatment required is also different. So let's start with acne-prone skin. It's mostly found amongst youngsters because of the rise in hormonal levels. So the sebum increases and the clogging of the pores also happens. The regular outbreak of acne is quite common in acne-prone skin. Clogged pores and inflammation. There is visible whiteheads, blackheads, and pustules. I'll be discussing about different types of acne later. So let's just go on now with what should be avoided if you have an acne-prone skin. Any skin product which has fragrance should be avoided because nowadays fragrance are synthetic and anything can be added to get that smell, which is quite dangerous for our skin. It can be irritating to our skin. So fragrance-based products should be avoided. Comedogenic products should be avoided. Now, what is comedogenic product? Comedogenic products are basically the ingredients which which chances of clogging the pores is higher, due to which there is increased chances of acne. So anytime that you buy any skincare product, choose a non-comedogenic product. So the ingredients would not be clogging the pores and there'll be chances of acne formation will be less. Now let's move on to the next one, that is sensitive skin tone. So with skin inflammation, the immune system is essentially overreacting to an irritant or allergen that the skin is exposed to. So any new product or any ingredient that you put on your face, your immune system overreacts to it and redness, itchiness, and there is swelling that might happen. So what are the characteristics of sensitive skin is? Red, swollen, and itchy skin redness that present with or without swelling, skin that stings or burns, rashes or hives, dry skin that may crack, blister, or bleed, patches of skin that feels dry, hard, and leathery. So any one of these or all of them can happen with the sensitive skin tone. What they should be avoiding is paraben-based skincare. Now, what is paraben? It is a preservative. If used for long duration, it can interfere with your hormones. So it should be avoided, especially in kids and people who are sensitive to ingredients which are highly reactive. Second is you should be avoiding SLS. What is SLS now? Sodium lauryl sulfate. That is an inexpensive surfactant. You can mostly find them in your shampoos, hand washes, body washes, because it's very cheaply found. But this really is carcinogenic if used for a long time, and it can irritate your eyes, skin, and lungs. So sensitive skin people should be avoiding SLS and paraben. Overexfoliation should also be avoided in sensitive skin tone. Mature skin. So mature skin is commonly found in aged people. So the common characteristics is thinning of the temples, sunken eyes, lines and wrinkles which are visible. What mature skin type should be avoiding is smoking and alcohol. Again, the collagen decreases if you smoke and if you drink alcohol. If the collagen decreases, so the elasticity of the skin decreases, making it more prone to your aging and wrinkles. Red meat should be avoided and overexfoliation should be avoided in mature skin. Okay, so let's move on to the next next topic. I hope you could understand different skin types and you can figure out what your skin type is with our previous slides. Now let's go on to skin through ages and how to take care of it. Here, I will be talking about different skin age groups and we will be discussing their concerns and how to take care of it. Okay, so skin in our teens. What is so unique about teenager skin? So puberty, you know that there is changes in the hormones, the testosterone and estrogen is rising. And due to hormonal level rising, there is stimulation of sebaceous glands to function strongly. So there is excessive secretion of sebum. And sebum causes oiliness of the face, as we have discussed earlier. Teens are actually already dealing with physical changes, mental changes, and they are also dealing with acne for the first time. So chances of low self-esteem, confusion is higher in teenage group. So we have to take care not only for their skins, we also have to take care of their mental health. So what are the skin concerns that teens would be having? Acne issues like acne vulgaris, blackheads and whiteheads, oily skin due to the excess sebum secretion, dandruff, eczema, excessive sweating, sunburns, and low self-esteem. Eczema, I'll be discussing about it later, so I would not go in detail about it now. Okay, so what is the ultimate teenage skincare routine? The first step, the first and the most important step that a teenager should be doing is cleansing their face. Do not let sebum build up, sweat and dirt and bacteria, they clog the skin, as we have discussed earlier. So washing your face with a mild cleanser is very important. Encourage them to wash their face in the day and during the night, because during the night, if you have put any makeup, it should be washed. And during the morning, it is important because your skin regenerates itself at night. So all the dead cell and the sebum secretion is on the face, on the outer layer of the face. So if you wash your face in the morning, it helps in getting rid of the dead skin. Choose a oil balancing cleanser, specifically a mild cleanser, and a natural dry cleanser is also fine. Why oil balancing is because if you use a harsh soap or a harsh cleanser, it will strip away the natural oil, due to which there'll be more secretion of sebum and the oiliness of your face will increase. Second step is toner. Now, toner is mostly optional, but I would still suggest to use it. Why? Because it prevents the excess sebum production. It maintains the skin pH level and makes a protective layer on the skin. But if you're using a toner, I would recommend to use a water-based toner, not a alcoholic-based toner. Moving on to our third skincare routine, that is moisturizing. Now, moisturizing is very, very important step, even if you have an oily skin tone, oily skin type. Because if you do not moisturize your skin, if you do not keep it hydrated, the sebaceous gland would be working faster and harder to create that barrier for your skin, making it further oily. So teenagers should moisturize the skin day and night to quench the skin thirst and leave it hydrated. Moisture can reduce extreme oiliness, as I have discussed, or extreme dryness to retain a well-balanced skin texture. Hydrating the skin also enables quicker cell turnover, thus leading to newer skin cell formation, which leads to acne treatment, acne getting healing faster, and the scar formation can also heal faster due to quicker cell turnover. Now, the fourth step is also very important, that is applying SPF, that is your sunscreen. Sun protection at any age is extremely important. Teenagers should apply minimum of SPF 30 daily. Now, in the bracket, I've written broad spectrum. Now, what is broad spectrum is? Make sure that your sunscreen is a broad spectrum sunscreen. Why? Because it covers UVA and UVB. So both the sun rays, the rays which are harmful, it protects it. And minimum of 30 SPF is fine. You can increase it also depending upon your requirements. Okay, so now that we have discussed the skincare routine, let's go for the natural remedies that teenagers can use. So those are, if you have suntan, so what you can use is a pinch of turmeric, 2 spoons of basil, and 2 spoons of curd. Mix it together, make a fine paste, apply it on your face, leave it for 5-10 minutes, and wash it. Before washing, you can also use it as a natural scrubber. You wet your hands and you slightly rub your face with that and then wash it. It can work as a scrubber as well. Potato juice. It is a natural bleaching agent, so you can use it on your scars or hyperpigmentation or under your eyes for dark circles. Aloe vera gel, we all know the benefits of aloe vera gel and juices, so I don't have to describe anything in detail. So you can use aloe vera gel as well. For acne breakouts, what should be avoided is high intake of sugar. All these pastries and cakes should be avoided. Excessive dairy products like cheese, butter, milk should be avoided. Any fried food should be avoided if you have a lot of acne. And hydrate your skin regularly because it helps in maintaining the moisture level of your skin. Moving on to skincare in our 20s. Now, what happens in your 20s is Early 20 is fabulous. Your skin is plump and bouncy because the collagen production is normal. It is, it can repair easily. Your skin can repair itself very easily. However, as you approach your mid 20s and your late 20s, this cell turnover reduces, due to which the dead skin buildups on your face and discoloration, elasticity, also discoloration increases and the elasticity reduces. By late 20s, the structural protein in your skin starts to decrease and cause fine lines. Young adults also like to experiment with makeup, so the chances of exposing themselves to skin irritants is also higher. Important here to notice the way you take care of your skin in your 20s will influence how soon you develop the signs of aging in your 30s and 40s. If you take care of your skin in your 20s, chances of aging reduces, or it goes way ahead if you take care of your skin in your 20s. So the signs of aging reduces because of that. What are the skin concerns in your 20s? Inflammation, dull, tired skin, puffy eyes, discoloration, uneven texture, and sometimes acne also are the main concerns in your 20s. So what skin routine that we should have is, first is cleansing. I've written double cleansing here because what is double cleanser basically is, it is first an oil-based cleanser. So all these cleansing oils and cleansing balms that you get in market is oil-based, and it helps in breaking down the makeup, which are waterproof, like waterproof mascara and other waterproof makeup that you have. So always cleanse your face first with a double cleanser. Use an oil-based cleansing oil or a cleansing balm. Wash off your face, remove all the makeup, and then use a mild cleanser or your regular face wash. So that is double cleansing. So what is to be done is remove makeup before going to bed with double cleanser. Skin repairs at night, leading to dead skin and sebum buildup. So it is very important to wash your face in the morning also with a mild cleanser or any of your regular face cleanser that you use. Second step is toner, as I have mentioned earlier. It helps in hydration, and use a water-based toner. Now, what you can add in your 20s is vitamin C. What is vitamin C is? It is an antioxidant. It fades away your dark spots, hyperpigmentation, and your skin looks brighter. It also promotes collagen production. Hence, it is also an anti-aging serum. So you can start with vitamin C in your 20s. Now, after that, you can use a moisturizer. You have to use a moisturizer. And if you require, then use an eye cream. It keeps your skin hydrated and well-nourished and prevents premature of wrinkles. SPF, again, a broad spectrum is required, and minimum of SPF 30. And it should be used even during your cloudy weather or rainy weather. Make sure that you use it every time during your daytime and reapply it after every 2 hours. Now, the sixth point is nighttime actives and weekly exfoliation. So now, by your late 20s, you can start with AHAs and BHAs. AHAs and BHAs are chemical exfoliation. I'll be discussing about that later. You can start with nighttime actives like retinols if required. And for the spot-related, skin issue-related actives can be used. Natural remedies can be same as what we have discussed in our teenage group. The extra would be puffy eyes because of constant screen time and mobile time, late hours. So eyes become puffy. So what you can do is use cold compress. You can use ice. These days, people put a bowl of ice and they dunk their face in it. So it helps in reducing the inflammation. You can use cucumber juice, and adequate sleep. Minimum 8 hours of sleep is required. Avoid alcohol and smoking. So let's move on to our skincare in our 30s. The aging starts to appear in your 30s. So it is very important to keep your skin hydrated and take care of your skin, avoid sun. So the risk of aging appears when they reach 30 plus. To maintain a healthy skin, it is necessary to provide adequate moisture retaining products. Skin concerns during your 30s are signs of aging, fine lines. There is dry skins, pigmentation, and again, you can have acne depending upon any skin health disorders if you have. and hyperpigmentations and other things. Skincare routine is quite similar: double cleansing, toning, and antioxidant serum, that is your vitamin C. Moisturizer is must, SPF is must, exfoliation, that is AHAs and BHAs. Now, what is AHA and BHA? AHA is alpha hydroxy acids. It is a mild exfoliating agent, chemical, like glycolic acid. You have to apply it during your night routine. So what it does is it removes the outer dead skin layer from your skin. So it gently exfoliates your skin. BHA is beta hydroxy acids, like your salicylic acids. It goes deeper inside. It's more effective if you have acne and blackheads. So those are it should be used weekly. Otherwise, if prescribed by your dermatologist, depending upon whatever the doctor says, you can use it. Seventh is retinol. Retinol is basically a vitamin A derivative. It helps in acne and in anti-aging. It should also be used after it has been prescribed by a dermatologist because it has a lot of side effects and it is contraindicated if a person is pregnant or is lactating. So please always use retinol if it's prescribed by your doctor. Do not use it otherwise. That is my suggestion. Now, moving on to natural remedies. For vitamin A, see, as I said, retinol can be applied tropically or can be taken orally. But rather than that, you should have vitamin A food, rich food, that is your papaya. You can have carrots. It is rich in vitamin A. Citrus fruits like orange, amla, lemon is rich in vitamin C. So you can have that. Facial massage. So these days, you know about facial yoga. That helps in reducing your fine lines, like your laughter lines and your crow lines. So facial massage also helps. Collagen-rich fruit like fish can be eaten. Collagen helps in increasing your elasticity of your skin, so it reduces the aging. Increase in physical activity. So if you increase your daily walks, like you go for 30 minutes walk or you do some physical activity, will increase the blood flow, which in turn will increase the cell turnover, which will give you a better looking, brighter looking skin. And hydration is a must. Keep drinking 8 glasses of water at least in a day. Okay, moving on to skincare in our 40s. So what is so unique about skin in our 40s? There is loss of collagen, which is quite evident. You can start seeing wrinkles and fine lines, and the laugh lines. There's major changes in the firmness of skin. There's loss of elasticity. Look for ingredients such as hyaluronic acids, glycerin, which can help in attracting and retaining the moisture of the skin. So what is hyaluronic acid? It's again a mild acid which helps in retaining your skin moisture. It's a humectant in a way. So take care of your skin around your eyes, neck, and your chest because that area also loses collagen and elasticity. So it's quite evident. You can start seeing necklines and the chest. It's also wrinkly. So make sure that you take care of entire area, not just your face. Overall, taking care of your skin in your 40s involves combination of hydration, sun protection, and targeted anti-aging. Skin concerns are wrinkles, loss of collagen, loss of volume, and elasticity. Those are signs of aging. Dry skin, age spots, and hyperpigmentation. What should be done is, I will not talk in details because I have already mentioned, gentle cleanser, double cleansing, moisturizer with antioxidants like vitamin C, sunscreen, SPF, minimum 30, and broad spectrum. Retinoids only at night and only if it's prescribed by a doctor. Hyaluronic acids. It maintains your hydration and is a powerful humectant. Exfoliation once a week would be preferable. Otherwise, if your doctor suggests more, spot treatment if needed. Natural remedies would be regular blood tests. Okay, so the skin concerns can also be due to other disorders in your body, like thyroid. If there is a thyroid disorder, there is hyperpigmentation. If there is a deficiency of vitamin B12 or folic acid, chances of hyperpigmentation is more. So regular blood tests will help you understand what is the main cause of all the issues that you're having. So if you can, understand the root cause and treat it, your skin will automatically start becoming better. Food rich in vitamin A, carrots, papaya, all the yellow and red food and fruits that you have. Citrus food, again, orange, amla, lemons, facial massage, intake of protein is important, more movement to increase blood flow and hydration. Okay, in our 50s, what changes is basically women go through menopause in their 50s. There is a lot of hormonal disturbances. Uh, there is hot flashes, skin becomes dry. There are a lot of hyperpigmentation and a lot of issues. There's a cell turnover decreases due to which the regeneration of cell reduces. So all the skin damage and injuries takes time to heal. The loss of elasticity is there and there is slow regeneration time. Therefore, your skin will be thin and the recovery time after the injury is difficult. Skin concerns in your 50s is sagging skin, dryness, pigmentation, aging, and wrinkles. So, what should be the skin care routine? Cleanse, moisturize, tone, eye cream, antioxidant, SPF every 2 hours. Actives like retinols, hyaluronic acids, and peptides. Now, what is peptides? Peptides is a protein. It's basically an amino acid which helps in increasing the collagen level, and that helps in elasticity and reducing the wrinkles on your face. Exfoliation again, once to twice a week. What are the natural remedies? Eat more healthy diets that includes vegetables and fruits and less red meat and other sort of meats. Stay mentally and physically active. That will increase the blood circulation and good cell turnover. Exfoliation, over exfoliation should be avoided and avoid any bad environmental condition like smoking and alcohol or extreme cold weathers or hot. All right. So now we have come to skincare for men. So all the men out there, this is for you. So why are we discussing skincare for men separately here is for the very main reason for the testosterone that is present in high level in male. Female have estrogen, and testosterone is lower level, but male have testosterone in higher level, due to which the secretion of sebum is higher. The male has thicker skin. The skin ages better because of the thicker skin and the skin is resilient. Hair follicles is larger, so the pores are also larger in skin. Men produce more oil because of, again, excess sebum secretion. So what should be done is, again, cleansing, exfoliation, moisturizing, sunscreen, hydration is all the same. Avoid smoking and alcohol. Avoid stress because stress level is higher in men. So what it does is it increases the cortisol level, which is a stress hormone. So that triggers more sebaceous gland to secrete more sebum, and that promotes more oil, and acne issues can happen, dandruff can happen. So you need to avoid stress. How you can avoid is regular exercise will help, maintain a proper diet, adequate sleep, minimum 8 hours of sleep will help, avoid excessive sugar intake, avoid touching your face unnecessarily, always shave your beard regularly, and as I mentioned, reduce your stress level. So if you take care of all these, the pores, again, I said the coagulation, you can use retinol for that and salicylic acids that can be used. But since the skin is thicker, so the doses increases and environmental factor also changes, the hormone level changes. So due to that, the degree and the percentage of requirement for all these actives also changes. That you need to check with your dermatologist. Okay, now let's move on to the skincare myths that we have. I have mentioned 4 skincare myths here. We will be debunking that, and I'll be explaining you why it's a myth. So let's start with the first one. So you have to tell me whether this is true or false. The first one is dermatologically tested and clinically tested makes the product trustworthy. What do you think? Is it true or is it false? You can write your answers in the chat box. It's true. Someone has written it's true. Okay, it's true. A. All right. A dermatologically tested or clinically tested product doesn't make it trustworthy. The answer is false, because when they say clinically tested, that only means one dermatologist or one doctor tested that product in their clinic, and within limited environmental condition, and they have approved it. It doesn't mean that the FTI or your Indian government has approved that product. It is a marketing gimmick. Whenever you see clinically tested, doesn't mean it has gone through all the levels of, uh, all the levels of test. It is just that it just means that one doctor has tested it and he has approved it. So that's why do not fall for it if your skincare products have written it's clinically tested, right? Moving on to the next one. Pores can open and close. Pores have like doors, it can open and close. Is it true or is it false? What do you think? Khushbu has written true. Sundara has written false, I think. Okay, most of you are writing true. All right. The answer to this is also false. Pores can enlarge and reduce because of the clogging, but they don't have doors. They do not open and shut. They can just be visible in certain skin types, and in certain it's minimal. Okay. Third one is people with oily skin do not need moisturizer. So if you have listened to me carefully in our previous slides, then I think you'll be able to answer this one. Do oily skin type require moisturizer or not? Preeti said false, false. Okay, mostly people are saying false. So oily skin type do not need moisturizer. The answer is false. You are right. Because as I mentioned earlier, if you do not hydrate your skin properly, chances of sebum secretion increases because your skin wants to protect your outer layer wants to create a barrier. So it creates more sebum, due to which there is more oiliness. So you should use a lightweight moisturizer or gel-based moisturizer, but moisturizing is important. All right. Fourth one is clean beauty products are not as effective as regular skincare products. I'm sorry. So is it true or is it false? False, false. Okay. That is right. Clean beauty products are effective as much as the regular skincare products because it has bare minimum side effects. Your regular skincare products might be effective, but it will have a lot of side effects. However, clean beauty products would have bare minimum side effects. So that's why it's up to you. You can choose either a regular chemical-based skin products or clean beauty skin product. But that doesn't mean that clean beauty products are not effective. They are equally effective with lesser side effects, right? So now let's move on to our next topic, that is common skin problems. So here we'll be discussing about acne, hyperpigmentation, and dry skin, even wrinkles and dry patches. So let's start with acne. I can see a lot of people have asked me about acne. So I hope this will help them understand better. Now, acne. Acne is mostly occur due to excessive oil secretion, dead cell, and the dirt getting trapped, sometimes even bacteria getting trapped on your pores, which clogs it and inflammation happens, and due to which acne happens. Now, there are different types of acne. It could be whiteheads, blackheads, pustules, papules, nodules, and cysts. So let's start with whiteheads now. If you can see the first picture on the top, you can see skin-colored, fleshy-looking bumps on the forehead. So these are basically whiteheads. These are types of acne only. So these are also called as closed comedones. Why closed comedones? Because the outer layer is covered. It's not exposed to the air. That's why they are also known as closed comedones. Whereas the blackheads, if you can see the nose here, has black spots on it. They are called open comedones because they are exposed to the air, and due to oxidization, the black color appears. So a lot of people mistaken it, they think that it is dirt, it is accumulated, but it's basically blackheads. So they are open bumps on the skin, looks black in color, and they are also called open comedones. Okay, so again, when the sebum, dead cells, which are trapped in the follicle are exposed to air, they get oxidized and turn black. It's the same phenomena, the same concept. When you cut an apple, so if it's exposed to air for a longer time, the apple becomes dark brown in color. So that is oxidization. Same with this. Now let's move on to the next one, that is papule and pustule. Same concept, dead skin, your oil, bacteria getting trapped in the pores, inflammation occurs, and the acne can happen. So in these, the bacteria multiply quickly, leading to inflammation and pimple appears. So now the difference between pustule and papule, if you see the picture here, pustule is basically, it contains pus. If a pimple contains pus, it's a pustule. It is painful. Papule, if it does not have pus, it can be painful for some it might not. Acne cyst and nodules. If you can see this picture, so acne cyst and nodules go deeper inside the skin, so it's very painful and tender. The cyst contains pus. If you can see this picture, it is quite large and it has pus in it and it's painful. Nodules do not have pus, but it's harder to touch and it goes deeper inside the skin. What you should be avoiding if you are prone to acne is, again, as I mentioned earlier, dairy products, high sugar intake, whey protein. These are the things which you should be avoiding. Now let's start with the home remedies first, and then I'll tell you about the medical treatments that is required for acne. Home remedies, tea tree oil. It prevents the growth of bacteria. However, tea tree oil should not be used directly on your skin because it irritates your skin and can worsen the skin. So it should be always diluted in a small amount, maybe a drop or two in your lotion or in your face pack. You can put 1 or 2 drops and apply it like that, but never directly on your face. Sugar scrubs. So sugar scrubs can exfoliate dead cells and on the surface, which can be used once a week. Don't over exfoliate yourself, but that can be done at home. Green tea. Wet green tea leaves can help reduce the oil production in your skin. And green tea is also an antioxidant. So these are the certain home remedies you can use for acne. But if you are suffering severely for acne, I'll be talking about the medical treatment. However, I would advise you to go to your dermatologist, get yourself checked, and get your own customized treatment that would be required for your skin type and your issues. These are the general things which our doctor uses. I'm just discussing about that in gist. First is salicylic acid. As I mentioned earlier, salicylic acid is a BHA. It's a mild acid which exfoliates your dead skin. It helps in removing the top layer of damaged skin. Salicylic acid dissolves the dead skin cells to prevent the hair follicle from clogging. So it helps in getting rid of all the clogging of your outer layer of your skin. Azelaic acid is naturally found in barley, wheat, rye, and other various grains. And it kills the microorganisms, so reducing the swelling on your skin. Benzoyl peroxide, they target the bacteria, they kill the bacteria, which often aggravates the acne. But benzoyl peroxide irritates your skin, it makes it dry. So these are the very common side effects that benzoyl peroxide has. So the dose, the percentage that is required, your doctor will be telling you. And when to be used is what your doctor will be advising you. Retinoids, again, as I mentioned, it's a vitamin A derivative. It helps in breaking down the blackheads, whiteheads, and other acne. It also makes your skin dry. So you need to moisturize your skin very often, which is, again, a non-comedogenic moisturizer, which is fragrance-free. And depending upon your skin type, what is required, your doctor would advise you. Retinoids should be not avoided, but is contraindicated, should be stopped if you are pregnant or if you are lactating. And other skin issues or other problems, if you're having retinoids, it's not advised. Retinoids can be topical or oral. That depends how your doctor wants to give you and what are the skin issues that you're dealing with. So that is the treatment. Now, other treatments that only after prescription you can get is antibiotics. If it's like pus fill and there is a lot of bacteria infection, so doctor can advise you antibiotics. Contraceptives and hormone therapy is also advised if the acne is due to the hormonal imbalance or other issues. So there are other things which your doctor will be advising you for acne. Now let's go to hyperpigmentation. So melanocyte cells, they generally give melanin, and what this melanin does is it is the this gives the color to our skin. So when you get tanned during the sun exposure, melanin is what makes your skin darker. So when those skin cells are damaged, they produce too much melanin. Some of them get clump and they get clogged, and which causing darker areas on your skin. So if you can see this picture here, some parts of our skin is darker than the rest of our skin. What are the causes? Causes could be acne scars, sun damages, hormonal fluctuation, thyroid disorder, vitamin B12 and folic deficiency, and genetics. So what we advise is to take a regular blood test, check your vitamins deficiency or hormonal imbalance, and that way you can be able to, reach to the root cause and treat it accordingly. Other management, which is like in general, which I'm discussing, is avoid sun damage, staying out of the sun, use sunscreen, and wear protective clothing, mostly cotton, use a hat, avoid synthetic clothes, stopping any medication that may be causing it, taking vitamin supplements, glycolic acid, which is an AHA that helps in getting rid of the outer layer, and discoloration also goes away. It helps in treating the discoloration. Kojic acid, it's a chemical that can reduce the amount of melanin in the body. So a lot of people use kojic acids in their elbow or dark knees. It helps in getting rid of the melanin production. Salicylic acid, again, is a BHA, as I mentioned. It is same as a exfoliation. Tretinoin is a synthetic derivative of retinol, that is vitamin A. Vitamin C and B3, that is niacinamide, can be used for the treatment of hyperpigmentation. Moving on to wrinkles. Wrinkles is very common in old age group. It's because of the slow skin production, cell production, and regeneration. So the thinning of skin layers and lack of collagen protein causes the wrinkle and sagging. Causes could be sun damage, smoking, loss of collagen, and treatment is SPF retinoids. And if you want to go into minor surgeries or go to the dermatologist, they can prescribe chemical peels, fillers, and botox. Dry patches. Okay. So dry skin occurs when your skin loses the moisture hydration. So it causes rough, flaky, and scaly patches skin. Causes could be weather, extreme cold or extreme hot weather, like deserts can cause dryness of your skin. Irritant, contact dermatitis, anything that you apply on your skin which might be irritating the skin can cause dry patch. Eczema. Now, eczema is an atopic dermatitis. It is a type of dermatitis. It's a condition where the skin barrier isn't working properly. So there is dryness, there's itchiness, loss of hydration, red bumpy inflammation, and it should be treated with mild moisturizer, which is again non-fragrant, and should be taken care by a dermatologist. Bacterial and fungal infection can also cause dry skin patches. What to do? Avoid hot water, extreme cold weather, and extreme hot weathers. Prefer soap which is closer to your skin pH level. Glycerin soap helps in attracting the moisture and maintaining it. Use humidifier in your room, and avoid medication that dries the skin, like harsh retinoids, AHs, and BHAs, because it strips away the oil from your skin. Now, with this, I think we have come to the end of our webinar. So now I can take some questions. Ritika, are you there?
Yes.
Should we start with our questions? I'll see if I can go through the questions. In case if I miss out something, you can tell me.
Sure.
Naman has written, I have acne on my face all the time. Is there anything I can do? I'm 27 male. Okay, so Naman, if you've listened to the webinar, I think I have covered everything about acne there. And since you are 27, so the change in the age group is happening, due to which all the skin routine that is required you can do. You can use salicylic acids, but after checking with your doctor. Mild AHs, BHs can be used. And if you have severe acne, then you should go and check with the doctor, and they can prescribe you a detailed, customized medical treatment for you, right? Okay, now second one is there any proven way to get beard? I have very less and patchy beard. Okay, You can use minoxidil, that is used by even a lot of dermatologists for if you have hair loss. But getting too much hair, chances are very low. But again, you can show to a dermatologist, check what is the reason why there is less beard, why there is less hair in your body. What could be the reason? Genetics or anything that is the reason. The doctor can, check that and can help you with it. Next is I have oily skin and acne-prone skin. I use Raga face wash only 2 times a day. Still not betterment. Is there any natural remedies? Naman, I have mentioned the natural remedies for you. You can use dry powder. That is, you get this uttan and the sandalwood powders. You can also use that as a face wash. It will help you retain, well-balanced skin care. I mean, wash. Also, for oily skin, I have already mentioned what to be done. So you can just go through those slides again. I think that will help you. Are there any more questions? How to treat blackheads on nose. I have done cleanup at parlor, but still blackheads doesn't go away. Can you suggest what steps needs to be done daily to stop blackheads? Okay, the parlor cleanup is temporary. So that is not a treatment, that is just a temporary solution. As I mentioned, for blackheads, you need to use AHAs and BHAs and retinols. But again, what percentage is required, how to use it, when to use it, your dermatologist would be telling you about that. Next is, I have pigmentation. Applying Corzylite at night, is that the right way? Yes, it is a kojic acid, so you can use it. And, it will take time for it to get better. So have patience and use it regularly. Any solution for chickenpox spots? Okay, so those are the scars after the chickenpox. Yeah, there are scars remain. You can use lactocalamine, which your doctors prescribe. You can also, after the prescription done by your doctor, I could suggest these AHAs and BHAs if your doctor advises you to. And others could be, you can start with your retinols and other things, but I would advise you to first check with your doctor. Okay, Ritika, are there any more questions? Am I leaving anything?
No, I don't think so. And I guess we're running out of time, right?
Okay, cool. I think we're done.
Yeah.
With all the questions.
Okay. Thank you, Dr. Ankita. Thank you so
My
much for
pleasure.
having us.
Thank you so much.
Thank you. Thank you so much for this wonderful session.
Same here.
Thank you. Take care. Bye-bye.